The U.S. Council on Violence Against Men and Boys is a dynamic public health initiative founded by men with lived experience dedicated to preventing and responding to violence against men and boys in the United States and worldwide. Today, we are a diverse collective of cross-sector stakeholders across the gender spectrum, driven by a shared commitment to change. We envision a future where the experiences and voices of men and boys are acknowledged and integrated into the broader movement for equity, justice, and well-being. Our mission is to collaborate with and strengthen public health stakeholders, fostering a collective approach to preventing violence against males. We will achieve this through the implementation of 5 core activities that include research, conducting and supporting research to better understand the dynamics, causes, and consequences of violence against men and boys, convening, bringing together diverse voices and perspectives to foster collaboration and innovative solutions, public mobilization, mobilizing communities and individuals to raise awareness, challenge norms, and stand against violence, advocacy, advocating for policies and practices that promote gender equity, justice, and violence prevention, and co-creating transformative learning, empowering those with lived experience and other stakeholders to lead, learn, and drive change. Our long-term outcome is an equitable and just world where every person, regardless of gender, can live free from exploitation and trauma. Together, we are committed to creating a brighter future for all. To effectively structure collaborations between community organizations, healthcare providers, and social services to prevent human trafficking and promote healing for males, the following key steps are essential. First, leadership and lived experience. Ensure that males with lived experience take on leadership roles and consistently involve impacted community members' voices in the decision-making processes. Secondly, prevention focus. Emphasize prevention by addressing social determinants of health, adverse child experiences, and negative community environments before victimization occurs. Third, healing and support. Collaborate with trauma-informed long-term medical and behavioral health providers, along with community organizations offering housing, mentoring, economic empowerment, advocacy, cultural affirmation, and education for comprehensive healing. Fourth, data-driven approaches. Invest in equitable research, including innovative methods like community-based participatory research to better understand the experiences of marginalized males and their communities. By incorporating these principles, collaborations can be structured to effectively prevent trafficking and promote healing for males while prioritizing leadership, prevention, and data-driven decision-making. 4 steps governments can take to ensure that their policies and legislation related to human trafficking prevention and support services are inclusive and accessible to male survivors are: first, gender-neutral language. Ensure that policies and legislation use gender-neutral language to encompass all potential survivors, regardless of gender identity. Avoid reinforcing stereotypes that trafficking only affects women and girls. Secondly, explicit inclusion. Explicitly state that support services are available to all survivors regardless of gender. This sends a clear message that male survivors are recognized and valued. Third, awareness campaigns. Launch awareness campaigns to educate the public, law enforcement, and service providers about the existence and unique needs of male survivors. These campaigns can help reduce stigma and improve understanding. Fourth, training and sensitization. Provide training to law enforcement officers, healthcare providers, social workers, and other professionals to recognize and respond to male survivors' specific needs. This includes training on trauma-informed care and cultural sensitivity. The healthcare field can play a critical role in preventing and responding to the unique needs of males who have been impacted by human trafficking. 3 examples include inclusive response protocols. Healthcare can significantly contribute to addressing the unique needs of male trafficking survivors by implementing comprehensive response protocols. These protocols should encompass specialized training in recognizing and assisting male victims, utilizing gender-inclusive and validated screening and diagnostic tools, and establishing culturally responsive linkages and referrals. This ensures that healthcare providers are equipped to support all survivors effectively. Number 2, enhance public health surveillance. The healthcare sector plays a pivotal role in preventing and responding to male trafficking survivors' needs by strengthening public health surveillance systems. This entails collecting and analyzing data on adverse child experiences, social determinants of health, and associated comorbidities. Such data can encompass conditions like HIV and AIDS, substance abuse, mental health challenges, housing instability, incarceration, and prior victimization experiences. Utilizing this data is crucial for informed decision-making and tailored interventions. And finally, the utilization of robust electronic medical records. Healthcare professionals can enhance their support for male trafficking survivors by implementing robust electronic medical record systems. These systems can provide trauma-informed clinical decision support, enabling healthcare providers to deliver more sensitive and effective care. This integration of trauma-informed approaches into the electronic medical record system promotes better understanding and consideration of survivors' traumatic experiences, leading to improved clinical outcomes. The International Conference on Violence Against Men and Boys, also known as VAM24, is a public health intervention to prevent and respond to various forms of violence and associated trauma impacting males around the world. The conference is scheduled from June 11th to June 13th, 2024, and is taking place both in person at the Hyatt Regency downtown Miami and virtually. Registration for this event is now open, and there's a limited number of discounted passes available for both virtual and in-person attendees. So mark your calendars and secure your spot. But what's the purpose of this conference, you might ask? Well, it's more than just your traditional gathering. VAM24 aims to bring together thought-leading change agents from across the globe. These individuals will collaborate to co-create knowledge and develop transformative strategies to address this pressing issue. The conference objectives are build a community of practice, raise awareness, reframe violence as a health issue, enhance prevention strategies, strengthen response and support, catalyze strategic funding, and empower engagement. The types of violence and injury that will be addressed include human trafficking, domestic, intimate partner and teen dating violence, child abuse, sexual violence, community and firearm violence, overdose, suicide, and other self-harm. Conference programming will include workshops on cultural humility and intersectionality, hospital-based violence intervention programs, mental health challenges and treatment, substance abuse, dependency, and overdose, HIV and AIDS, chronic and acute health outcomes of violence, innovative funding streams, case studies, lived experience, consultant presentations, collective impact, and more. Interactive sessions such as action planning, fireside chats, research roundtables, and World Cafe style activities modeled after the World Cafe Community Foundation. So get ready to join the 2024 International Conference on Violence Against Men and Boys, a platform for transformative change in public health. Save the date, register now, and be a part of this global effort to make our world a safer and healthy place for all.
Thank you much, Michelle. I would like to invite Nathan, Francesco, and Perry to join me for our panel discussion. Perfect. So our questions for today. So I will start with the first one. What are some trauma-informed, culturally sensitive approaches to engage diverse communities in conversation about human trafficking, child sexual abuse, violence, masculinity, healing, while acknowledging the unique social context? Nathan, would you like to add anything to that?
Sure. I think for me, just speaking specifically to engaging with at-risk males in those marginalized communities, we have to practice cultural humility and be mindful of our own privilege. Trauma is subjective and it impacts people differently, and the adverse community environments that people live in can enhance or can pronounce that type of trauma. Cultural humility, I think we hear a lot about cultural competence and learning about the differences and how to engage. But I think that cultural humility is so important because it teaches us to really try to understand, be mindful that we might not have all of the answers. allows us to better understand the experiences and how different cultures, cultural experiences, systemic racism, other barriers might make it even harder for people to disclose, but also that manifest those opportunities for exploitation. I also think it's important to really acknowledge the shame, the fear, and the stigma that's so often associated with having these conversations within some of the males within these marginalized populations. Francesco spoke to it really loudly in his presentation on creating a sense of safety and trust and what that means, and that can look differently for different populations. So I think the culmination of those really comes down to cultural humility and really active listening.
That's fantastic. Thank you so much, Nathan, for sharing those insights. And I've definitely learned that through the research itself, interviewing different nationalities, different ethnic groups, and you can definitely see that there are very different barriers that come up depending on what ethnicity that you come from. And instead of just going forward and disclosing, some communities have that sense of bringing dishonor to the whole community or to the family, and that alone can stop them from disclosing. And it's very important to understand those sub barriers as well, just in those different communities, so we can create those safe spaces they don't just fit that one box, but really expand to anyone that really goes forward for help, or just to understand those that don't come forward to get help. Thank you very much. So let's go to our next question, and it's, what do you suggest to men and boys that are seeking help? Nathan, is there anything that you would like to add to what would you suggest to men and boys that are seeking help?
Sure. I mean, that was spot on, Perry. Thanks for sharing that. I think, this isn't your fault, right? To reinforce that you're not alone. So many men think that there aren't any other men that they can disclose. But I think taking it a step further and helping to explain, what is the result of unaddressed trauma, right? Sometimes it manifests in substance dependency or alcoholism or acting out or other depression and PTSD. And I have so many young guys go through life thinking that they're broken. And so I think taking the time to kind of explain that this is how trauma, these things that have happened to you, this is how these things manifest, but that there's help, there's recovery available to you.
Thank you so much, Nathan. And no, thank you so much. And of course, we have to look at it that way as well to make sure that we're looking at the situation in a more holistic manner. And when I was doing my research, I was able to get 40 male survivors to tell me what was helpful to them and what wasn't helpful to them in the master's thesis. And it was very interesting because they actually made kind of like a progression chart of the very first thing was admitting that something had happened, and really kind of going through that, their own self-research, starting to really ask those questions to themselves and looking for more information. And then that's when the next step, which Perry had mentioned, it was just find one person to open up to trust, to speak to, and then that can lead to community. And then that can lead to then actively getting help, going to someone that is trauma informed, that is specialized in the type of trauma that you need. And then furthermore, going after things that bring you joy again and bring you that happiness, so that you can kind of start going into that thriving and not so much into just surviving. And so if anyone was interested in looking at that, Michelle has it in one of the handouts. It's the master's thesis, and that was created by survivors for survivors. But that leads me into the last question, which is, can you tell us about any toolkit items, books, programs, or initiatives that you would like to highlight? And so that leads me to Nathan. Would you like to share with us anything that you're doing, any books, programs, initiatives that are coming up?
Sure. Just one final quick plug for the conference on violence against boys and men. I've shared on that previously, and the attendees have information on that. It's June 11th through the 13th here in Miami. Global in scope, and we're always looking for global partners on the planning, delivery, attendees. So I encourage everyone to check out the website for that. But in particular, I uploaded 2 handouts to the folder here that everyone has access to. The first is an issue brief that I co-authored with National Youth Law. This was Understanding Commercial Sexual Exploitation of Boys and Men. It was a collaboration based on several focus groups with males with lived experience. And we break down risk, vulnerability, but most importantly, service recommendations. So recommendations how to engage in males with lived experience. The other is a handout that was developed by the National Human Trafficking Training and Technical Assistance Center on enhancing services for males experiencing trafficking. Really powerful finding on using motivational interviewing and universal education. They found to be really successful or really effective in engaging with males. And then the other is a listening session from a series or a report of listening sessions that the same organization conducted with males, really asking males, what are risk and vulnerability? How do we engage? And so I'll put the link to that, to the latter one in the chat.
Thank you for sharing, Nathan.